Okay, we are officially recording. This is the session to follow up on CP2. We're going to be focusing mostly on the patho and the nursing care plan aspect of this assignment. I do have the chat box open, so if you have questions, throw them on in there and I can answer them. I just want to make sure that I get everything clarified for you, that if there's any questions that you have, that we're answering them. Now, that being said, I also know you have an exam on Monday. So if you are prioritizing, the exam comes first, but after our discussion and with the work you did with the scenario, hopefully it won't be too difficult for you to complete the CP2. It is not due, the remaining parts, the pathophys and the care plan piece are due Thursday, April 16th to the Dropbox by 23:59, okay? All right, let me pull up this PowerPoint and share my screen here. And we will get started here. Okay. Okay, I'm just gonna pop through the first couple slides. This was the same one that I used yesterday. I did post it, so you may have actually seen the entire thing, but I want to talk through a couple pieces of this. We're past the narrative assessment, so let's kind of move on from there. Okay, so now we're moving on to the pathophys statement. Okay, so this you're going to type on the actual CP2 assignment template. Okay, so it's a Word document, you're going to type into it. This contains both the patho statement part and the nursing care plan part. So it's a Word document. It just, when you're done, it gets uploaded to the assignment Dropbox. Do make sure you're putting it up in the correct Dropbox. The Med-Surg Nursing Care Plan Portfolio Assignment, it is the same place you put your narrative. Okay, so when I look at that Dropbox next week, well, I did already look at it just to make sure everybody uploaded their narratives. But when I look at it next week, it's going to show two separate uploads. It'll show your narrative, what that was this week, yesterday, and it will show your assignment for next week. Okay, so what you want to do, because you've already did the beginning parts of the pathophys statement as part of the alternative clinical experience template. Okay, so start with what you have. Okay, I want you to review your work, take a look at your clinical instructor feedback, take a look at your Hinkle, take a look at your ATI, take a look at, this session if you need to kind of reflect back on it, and you want to be able to make any additions or corrections. I'm going to skip forward to the template for a minute because I just want to emphasize a couple things in relation to this. Okay, so when you talk about related body system normal function, and we're talking about COPD here. So COPD has an issue both with ventilation, okay, because sometimes they have difficulty bringing oxygen in, but they have difficulty exhaling CO2. So there's a ventilation, a breathing piece, and then there is a gas exchange piece, because with emphysema, there are issues down with the alveoli that hinder that CO2-O2 exchange, okay? So when you're doing your explanation of the related body system normal function, you do want to make sure that you are explaining those aspects of it, okay? I mean, yeah, it's nice. You can mention that the left lung has 2 lobes and the right lung has 3. But that really isn't the big focus of that. So just make sure that you are addressing the body system normal function, that relates to the disease process. Okay. Then when you get to the disease process at the cellular level for COPD, you need to make sure that you're addressing both pieces. So there's some key factors to COPD: the mucus production, okay, the increased secretions, the cough. So you have that aspect of it where you have the increased secretions, and then you have the problems down at the alveoli where you have the impaired gas exchange. So you want to make sure that you are addressing both of those, because when you talk about COPD, the 2 big diagnoses that you have are the chronic bronchitis and the emphysema. So just make sure that you're addressing the pathophys aspect of both of those, okay? Clinical manifestations usually isn't an issue. Lab and diagnostic tests commonly used in making the diagnosis, okay, include the rationale. So for example, if you are telling me that pulmonary function tests are one of the things that are commonly used in making the diagnosis, please don't just write pulmonary function tests. You know, give me a 1 sentence, 2 sentences, what is it, and what is the purpose? Okay, so PFTs, we use them to make the actual diagnosis, but we also use them to track how the disease is progressing, okay? Chest x-rays will often show hyperinflation. So tell me about that. If we're doing a chest x-ray for an exacerbation, it's likely going to be to rule out any type of infection, okay? All right, hold on a minute. I don't know why my chat box isn't showing here. Let me just check that out here. Oh, okay. I don't know. I'll have to figure that out at the end, and then I'll address your questions as we go. So for the lab and diagnostic test, just make sure that you are including the rationale, like what does that test do? How is that beneficial to COPD? Okay. For common medical treatments, make sure you are addressing both pharmacological and non-pharmacological treatments. So you should have a paragraph for pharmacological, a paragraph for non-pharmacological. With the pharm, if you are talking about a particular classification of drugs, for example, bronchodilators, okay? Well, there are long-acting bronchodilators and there are short-acting bronchodilators. What is the difference and why are both used in the management of COPD, okay? Are there other classifications that are used in the management of COPD? Both long-term maintenance management and short-term acute exacerbation management, okay? Think about corticosteroids. Which ones would be for long-term management and what would we use in an acute exacerbation? Make sure you're differentiating that. Oxygen is considered a medical treatment, okay? So don't just tell me that, well, we put them on oxygen. Okay, how does putting them on oxygen help? And are there special considerations about oxygen in relation to COPD patients? You took care of Hector Gomez. I hope you picked that one up on that video as to why we had to turn the oxygen down, okay? For non-pharmacological treatments, think about things that don't involve drugs, positioning, hydration, nutrition, and not just listing those items, but providing some details like what do I mean by hydration for a COPD patient? What do I mean by it and how does it help? How does it help manage COPD in somebody? How does it manage the disease process, the symptoms in somebody with COPD? Okay, so don't just list them there. You have to explain what it is and why we would use it. How does it help the patient with COPD? Okay. For the teaching statement, particularly for the client treatment section, please try to tailor that a little bit more to Hector Gomez, okay? You saw the entire scenario. How was he treated, okay? Specifically to the COPD. All right, you don't need to put the stuff in there about the chest, this thoracentesis and chest tube, but how was the COPD itself treated, okay? Tailor that to him. All right, let me pop back here for a second. The other thing that you need to do is to address the client-specific prompt in each of those boxes. Okay, so I'm going to flip forward again, and you'll notice here, relate etiology risk factors to client. So based on the scenario, what risk factors did Mr. Gomez have for COPD? Okay. What signs and symptoms did he specifically exhibit related to his COPD exacerbation? Okay. What client-specific results, lab and diagnostic tests directly related to his COPD exacerbation, and the pneumonia, because the pneumonia was what was causing the exacerbation? Okay. Treatment-wise, how was he specifically treated? What breathing treatments was he prescribed? Did he get an antibiotic? Did he get a different antibiotic? What were we doing to treat his COPD, both pharmacologic and non-pharmacologic throughout the scenario? Okay. Now, You have the option of going back into the scenario, but I did go in there and took some screenshots for you. So for the client risk factors, signs and symptoms, and the lab and diagnostic results, I did post this PowerPoint on Plato so you can access it, but I took screenshots of what was there. So this is actually the beginning part of his lab. So this was his CBC. So I put all of the labs in there. I didn't pick and choose. You can determine what you want to put in there in relation to when you're discussing the lab and diagnostic tests. Remember, you're selecting things that focus directly on his diagnosis, the COPD, as well as the COPD exacerbation. So I do have screenshots. So there you can see the CBC. This is his chemistry panel that you can see in there. ABGs are there as well. His blood alcohol is there. And at this time, the cultures were pending, okay? And I don't believe, I didn't see at the end that they ever had results on what those were. So those were pending, but you know that they were performed. So it would be appropriate to say in there, you know, these cultures were obtained, results were still pending. I also included the urinalysis results, so those are there as well. Okay, basically I just took screenshots of each part of that. I included the radiology report. This is his initial chest x-ray, okay? Because the second chest x-ray that they did related to the pleural effusion and then the thoracentesis and all that. So I'm really focusing on the COPD portion of this. So this was his chest x-ray that was done. Okay. Now, as you're continuing down that pathophysiology statement and you get into the medical surgical treatment, you want to focus on the orders and the progress notes, and you focus on the MAR, because that's how you pull in that client specific stuff. Okay. So I also took some screenshots of that. So this was the initial MAR. So you can see he had the ceftriaxone, the nicotine, the prednisone, and I know this kills me on the screen. For the purposes of your patho statement, write it as it is on the screen. I just want to clarify, we don't give prednisone IV. Prednisone does not come IV. It's methylprednisolone, and it would be a much different dose. But regardless, this is what was in the scenario for you. So this is what you're going to base it on. But just as a general knowledge point, prednisone is given PO. It's methylprednisone that's IV bolus. It's those little things that kind of kill me. Same thing here. Look, there's your breathing treatment. There's your saline lock, flush. You also have an antipyretic analgesic there as well. Okay, so those are your orders. So when you talk about client-specific treatment, you can pull from the orders from the meds. You can also pull from the actual orders and progress notes. So here you can see how the vital signs were prescribed. You can see what the oxygen order was, and you know what he was, you know, actually in the video. He was NPO at first. As I moved to the next slide, when he was first coming from the ER, he was NPO. They did clarify that and get him put on a diet. So you want to go with the most recent diet there. Now, remember, this is what the provider prescribed. So in relation to diet, are there recommendations that you could make to his diet that would help support functioning in a COPD patient? Although it's not prescribed, you could collaborate with the provider, you could collaborate with dietary to be able to get that order. So just kind of think about that when we get to the care plan piece, okay? But there's the remainder of his orders. You can see in there, blood sugar checks, there's the ceftriaxone. There's the salmeterol, there's the Proventil, your stuff's there, the soft diet. So I copied that for you to see. Oh, okay, here my chat box popped up here. Okay, let me go back and answer your questions. Can we use information from the patho, from the clinical prep to work from? Yes, you need to. That you've already done most of the work. Okay, so use that as a starting point, add and tweak anything that you have to. If there's things that you need to expand on, maybe address the rationale pieces as I was talking about a little bit more. Do you want us to talk about emphysema and chronic bronchitis in the patho? Yes, because COPD is both of those. For pharmacologic ones, are we to use the specific ones on the EMR for Hector? For the client specific section, that's where you're going to put the stuff from the EMR for Hector. When you're talking about the general medical surgical treatments, that's you're talking about COPD in general, okay? The whole idea of this pathophys statement is you hit those areas, you develop those areas generally about COPD, and then you have the client-specific area where you're incorporating Hector Gomez specifically. So for signs and symptoms, here are your classic textbook signs and symptoms of COPD, cited, of course. And then underneath that, client signs and symptoms. So Mr. Gomez exhibited blah, 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 blah. What symptoms did he have? For the narrative, NPO is fine. I'm not worried about that. Okay, so moving on to the nursing care plan part. Okay, so based on your narrative assessment documentation and what you saw in the video at the beginning and everything, what was the priority physiological nursing diagnosis? So that should be a NANDA label. Okay, you should be able to find that in your Lippincott. What NANDA are you going with? You need a related to, and you need an as evidenced by. Just a hint, your as evidenced by is your assessment data. Okay, what made you believe that this was the priority physiological nursing diagnosis? Okay, the related to is the causative factor, and the NANDA, of course, is the actual label. So with this, before I move farther on, I want to emphasize that there are resources for you on Plato. Okay, there are resources there to help you both with the patho statement and with the nursing care plan. Okay, look at them. They are there to help you. If you're struggling with, what the related to factor, make sure you look at those resources. They are there to help you. Okay, so once you have that, your next piece is going to be to develop an overall goal that directly ties to the priority physiological nursing diagnosis. Okay, so it has to tie to the priority nursing diagnosis. So for example, let's say we were taking care of a patient and their priority physiological nursing diagnosis was acute pain. Obviously, that's not the case for Mr. Gomez. I'm not going to give this away. But let's just say you have a patient and their priority physiological diagnosis was acute pain. Your goal is not going to be, client will be able to ambulate to the bathroom without becoming short of breath by the time of discharge. While that might be an applicable goal for your patient, it does not tie directly to your selected nursing diagnosis. So you need to make sure whatever nursing diagnosis you pick, you need to have your goal relate directly to that. Okay, so very important. You want to write your goal, your time frame should be discharge. Okay, because typically that's what we do in acute care. Your time frame is going to be discharge. So it has to be realistic for Mr. Gomez. What should he be able to achieve by the time of discharge for whatever priority physiological nursing diagnosis you selected? Okay. For the psychosocial piece, and this is really, really important because this piece of the care plan addresses your ability to meet the clinical behaviors for consumer-centered care. I said in yesterday's session, all of these relate back to specific behaviors in your weekly clinical evaluation. So for this, you want to use the information that's provided in the scenario to identify and incorporate those psychosocial factors into the plan. Now, because this is a scenario that was ATI, if there's something that wasn't addressed, for example, maybe it was religion, wasn't addressed, just simply note that in your template. You can say, I would consider Mr. Gomez's religion. It was not specified in the scenario. Okay. Let me check the chat box here, see where's my chat box? Okay, this is weird. Hold on, let me go back here. I know there's people in the chat. Okay, it'll pop up again. It popped up last time, just like in the middle, and I'll address it when it pops up or at the end. It's just not popping up on my screen for me right now. So for this psychosocial piece, going back to the resources that are on Plato, there are some examples of this on Plato in the student resources, both on the clinical side and on the classroom Plato in the supplemental instruction section. There's some good examples of this. But when we talk about psychosocial factors, these can be things related to family dynamics. So what did you note in the scenario related to Mr. Gomez's family dynamics? Who was the support person? What was their relationship? How did they interact? You know, Mr. Gomez was a recent widower. So thinking about how that ties into the situation. How does his developmental level tie into the situation? What resources does he need at home? If you looked at his discharge orders, he has some stuff he has to go home with. So how does that all come into play? So this is where you're addressing those psychosocial factors. And again, this ties back directly to the consumer-centered care piece. This is what we do as nurses. We individualize our care to take care of these patients. All right, from there, you need 7 interventions, okay, 7, that directly relate to the selected nursing diagnosis, okay? So whatever NANDA, whatever nursing diagnosis you select, your interventions have to relate to that diagnosis. And you can do that through the intervention, you can do that through the rationale piece, but they have to directly relate, okay? You know, again, if your patient's problem post-op, your priority problem was acute pain, teaching your patient about, I don't know, hydration, that they should be taking in 2 to 3 liters a day to prevent constipation, unless their abdominal pain or whatever is related specifically to constipation, those don't really directly relate, okay? So you wanna make sure that the interventions that you're using relate to the selected diagnosis. Now, don't reinvent the wheel here. Look at Mr. Gomez's EMR. What were some of those orders? What were some of the things that we're doing for the patient, both pharmacological interventions and non-pharmacological interventions that address your selected nursing diagnosis? Those are the specifics. That's how you individualize it to him. Look at the scenario, look at the orders, look at the progress notes. So if you are, you know, looking at a care plan book, remember, they have never seen your patient. They've never seen Mr. Gomez. They have no idea what he looks like, okay? If your patient had acute pain and you looked that up in either Lippincott care plans or maybe of Ackley NANDA book, it's gonna say administer pain medications as prescribed. Okay, well, how do you individualize that to your patient? What specific drug, dose, route, and frequency was prescribed? So if you're kind of looking at in relation to respiratory, not just administer breathing treatments, what breathing treatments were prescribed? Okay, so you want to make this specific to Mr. Gomez because that's what we do. You know, as an RN, I don't write individual care plans. I don't write that traditional student nurse care plan. But what I do is I get that call from the supervisor that says, hey, you're getting an admission from the ER. They're a 74-year-old male admitted with chest pain, roll out ACS. Okay, right off the top of my head, chest pain, ACS. Okay, what is their focused cardiovascular assessment? Have they received their dose of aspirin? Are they on oxygen? Did they give them nitro? What do their cardiac enzymes say? You know, did they get an EKG? So I'm already thinking through that process. And the reason I can do that is because of developing my nurse brain through pathophys statements and care plans, okay? As an RN, you are not gonna write the student nurse care plan. You are gonna be using essentially pre-printed plans of care that you then individualize to your patient. So if we're giving an antibiotic for an infection, your pre-printed care plans are gonna say antibiotic. But how do I tailor that to Mr. Smith? What specific antibiotic dose, route, and frequency is Mr. Smith prescribed? That's how you individualize it. Okay. I again copied and pasted this in just, you know, to kind of show you. Again, this is how, if you're going to talk about vital signs in your patient, okay, as one of your interventions, they were prescribed every 4 hours. So you can put that in there as your frequency. Now, who does the vital signs? You also want to indicate who can do each intervention. So an RN, LPN, or the AP can do the vital signs. When you're talking about the oxygen via nasal cannula, who can do that? The RN, the LPN, also the respiratory therapist. Don't forget your ancillary people. If you have something related to activity, PT and OT can assist with that as well. So we're really looking at a collaborative plan of care, but part of it is who can perform those interventions. Okay. On this side, I continued with this, but then I also put the remainder of the interventions there as well, just so you had it to be able to refer to, because it also had the discharge instructions as well. Okay. So for each of your interventions, you need to have 7. For each of your interventions, you need to include a faculty level rationale. Okay, so your rationale has to clearly explain how or why the intervention works to address the problem, to address the nursing diagnosis. Okay, so for example, just like you talked about up in the patho statement, if your intervention, and I don't want to give it away, but let's say you do an intervention related to your patient's breathing treatments. Okay, so in your rationale, whatever that medication is, you want to clearly explain how and why that medication, that breathing treatment works to address the primary nursing diagnosis. Okay, so how does it improve their breathing? How does it improve their gas exchange? Okay, be specific. Rationale, when you're getting them, you have a lot of resources. Your Hinkle book is a great resource. If it's something medication-wise, you can use Hinkle. You can use your Lippincott Advisor for that. If it's something foundational, something as simple as, you know, nutrition, hydration, things like that, Taylor, or your fundamentals book, whatever your fundamentals book is a great resource for that foundational type stuff, okay? Use the resources that you have. You do not need to go out and find articles. You do not need to go out and find extra stuff, okay? This is COPD. This is a standard diagnosis. It's not something crazy that you need to go out and find outside resources. Use what you have. This isn't meant to be something that's extremely anxiety provoking. I want you to think about this and I'm taking care of this patient. How do I plan to take care of this patient? What are we going to do? How are we going to do it? Who's going to do it? How is this going to benefit the patient getting better? Okay. For the evaluation piece, you need to write an evaluation statement. Okay. So that very last scenario, okay, and your discharge orders, whatever you formulated your goal to be, okay, you need to look at what your goal was that you developed. At the very end, did he meet it or did he not? Okay, if he met it, great, goal met, and you can just repeat what the goal was. If he did not meet it, goal not met, okay? And then tell us why and what are you doing about it, okay? So maybe the goal was that he would be off of oxygen by the time he went home, and that wasn't the case because he's going home with home oxygen. So you just simply state that, okay? So that's working through that care plan. Again, make sure, let me come back to stop sharing my screen here and then I can see all these chats. Make sure you are using the resources on Plato to help you. There's some care planning resources there. There are APA resources there, okay? Please, I don't want, it kills me to take points off for APA, okay? So use the handout there, use that to help you. Please, grammar spell check. Have somebody else read your work, okay? If you don't have somebody else to read your work, you read your work, but you read it out loud. Read it out loud to yourself. Because if you're reading it out loud and there's an error, you're going to pick it up as opposed to if you're reading it silently because your brain is going to correct it, okay? So use that. Like I said with the narrative, when you looked at the narrative, look at the rubric. Do the same thing with your pathophys statement and the care plan piece. Look at that rubric, okay? All right, let me get back into the chat questions here. Okay, do we determine whether a goal is met or not met? Yes, so based on that very last scene, and also based on the discharge orders, whatever your goal is that you created, because some of you, depending on what you write for your goal, he might have met his goal, he might not have met his goal. So that's going to be very student specific as to how you formulate your goal. Okay, but yes, you do need to write an evaluation statement, determine did he meet the goal met, or goal not met. If the goal is not met, you have to tell us why. What are you doing about it? Okay, are you looking for everyone to choose the same nursing diagnosis? You need to pick your nursing diagnosis. The requirement is that it is the priority physiological nursing diagnosis. Now, that being said, there are several respiratory related diagnoses. Okay, so look at his condition, look at this scenario, and look at the definitions of those. Does he really fit ineffective airway clearance? Does he really fit ineffective breathing pattern? Does he best fit impaired gas exchange? Look at those. I mean, they're very similar. And, you know, regardless of that, it is respiratory. So, you know, you're looking for a respiratory diagnosis here. You know, and a lot of those interventions are similar. But if you really think about the patho, there's one that fits best. Okay. But I am looking for a respiratory related diagnosis. I'm not looking for your NANDA to be knowledge deficit. That's not the purpose of this. This is a med-surg physiological based thing. When you do your CP3, that's a teaching statement that is focused on knowledge deficit. Okay. When is discharge? Okay, Logan, I'm not sure what you mean by that. What do you mean, when is discharge? You mean like a specific date? If you're writing your goal, you can just say at the time of discharge. You don't have to put a specific date on it. I know in same-day services, some of your instructors liked you to put the date on it, you know, by the time of discharge on such and such a date. Just by discharge is fine for this assignment. Okay. I think I addressed everybody's questions. If you have last-minute questions, go ahead and stick them in the group chat. And I'll be happy to address those. Again, this recording will be up on the class YouTube page, so you can refer to it after you take your exam on Monday for when you're finishing up your CP2. And then if you do have questions as you're working on it after the fact, you know, I cannot preview your assignment. Like I cannot like look at your screen and tell you that. Because I just physically can't do that for all of the students. And what I do for one, I have to do for all. I'm all about, you know, being fair and equal. But if you're stumped, talk with your peers. You can talk with me. You can send me an email. Hey, I'm thinking that nutrition might be something important with this patient. And we kind of talk it through. But I mean, I can't look at, hey, can you look at my intervention and tell me if it's okay? I can't do that. But I'm happy to help talk through this with you. I would also encourage you to talk with your peers. Because you're kind of all dealing with the same case. That being said, you really do want to do your own work. You know, you should not really be working in groups to complete the whole thing, but it is totally okay to bounce ideas off of each other. There's a lot of learning that happens with that collaborative piece. So, all right, I don't see any more questions in the chat box, so I'm going to go ahead and end this. Enjoy your weekend. Just a reminder, I do have that exam review prep session at 8:30 on Monday on Zoom. Would love to see you bright and early, get you kind of pumped up for that test. Okay, so spiritual needs and education were talked about, so we don't have to include them. You don't want to ignore them. You do want to just say, you know, spiritual needs, religion was not addressed in the scenario. Just put a statement like that in your psychosocial stuff. So I know, so I can tell that you at least considered it, because by you saying that in there, I know that you considered it versus just leaving it out. Well, did you not consider it, or did you leave it out because it didn't apply? It's kind of like, you know, not documenting pain, or no complaints of pain versus denies pain. You just want to be very clear. Okay. All right, so have a great weekend, and I will see you guys on Monday.